I'm Dr. Richard Cartledge, and I am a cardiovascular and thoracic surgeon at Delray Medical Center. There are a host of procedures that I perform at Delray Medical Center. They include the entire gamut of cardiovascular surgery, including minimally invasive valve surgery, complex valve repairs, off-pump bypass surgery. From the standpoint of other non-cardiac thoracic procedures that I do esophageal surgery, lung surgery, minimally invasive lung surgery, and also the full gamut of vascular surgery and endovascular surgery. One of the reasons why I practice at Delray Medical Center is because this is one hospital that really takes pride in quality and results. And a surgeon can be great, but if they're at a location at a hospital that is not commensurate with the culture of excellence and quality results, it's hard to be an effective and safe surgeon. Delray Medical Center has one of the top ratings for cardiovascular surgery actually in the country.
Hi, my name's Christine. I'm 68 years old. I live in Kings Point and I'm retired, and what I do is I like to have fun, and part of my fun is having parties.
Christine is a lovely patient of mine. I met her in the hospital, and the first thing she told me is, Dr. Cartledge, I just recently retired and I was looking forward to a wonderful retirement, and I started getting chest pain. Started getting chest pain while I was doing the things I loved.
Well, my condition was I couldn't breathe, and my heart was pounding so severely. When I used to sleep at night, or try to sleep, I didn't even dare wiggle my toes because I was afraid to move. The pain was so severe and so intense.
She was admitted to Delray Medical Center, had a catheterization of her heart, and that identified that she had 4 blockages in her coronary arteries that clearly, in retrospect, was giving her the symptoms that she was having, where she wasn't able to enjoy retirement. She was extremely apprehensive when she heard that she needed heart surgery. And after speaking to her for a good hour and reassuring her that the chance of her getting through the heart surgery is as good as if she was coming in for a gallbladder operation, she smiled, held my hand, and said, "Go ahead and do it, Dr. Cartledge." We did the heart surgery. She was in the operating room for 2.5 hours, and she was home on post-op day number 4 and entertaining 3 weeks later. She's now enjoying her retirement.
I've gotten so much support from Delray Medical. The staff has been just superb. And I'm not just saying it to say it. I mean, if I start talking about individual ones, I'll start crying. I mean, they've just been so wonderful to me. I'm feeling just wonderful now. Better than I have felt, I almost hate to admit it, in probably 20 years.
For many years, it's been thought that cardiovascular disease, specifically coronary blockages, are the biggest killer in the nation. But interestingly, valve disease is sharply on the rise. Many people have been told they have a murmur. Recent studies have shown that certain types of murmurs can be actually fatal in a very short period of time if not identified and treated. To that end, we've set up at Delray Medical Center a specialized valve clinic. Many patients are quite apprehensive to have heart surgery, especially if they have a valve problem. It is a serious operation, but people should know that here at Delray Medical Center, not only do we have some of the best results in the country for our valve surgeries, but many times we can repair certain valves, namely the mitral valve, and not have to replace it. Patients usually go home after their valve surgery in 48 hours. Catheter-based valve replacement's been around in this country and FDA approved for about a year. What people don't know is that there are great limitations to catheter-based valve procedures. And it's being able to figure out which patients will benefit most from these procedures and which patients won't. We are one of the first hospitals to develop a multidisciplinary valve clinic. The purpose of the valve clinic is to get to the bottom of anyone's valve issue. We decide what type of procedure would give the patient the most benefit with the least risk.
My name is Linda. I live in Boca Raton, Florida. Been here for 20 years, originally from New York. Moved to Florida for the beautiful weather. I have a very active lifestyle. I'm 47 years old. I've have a pet sitting business that I've been doing for nearly 20 years. So I am a very active person. My condition is a mitral valve regurgitation slash prolapse. Did not know I had that. It was actually a congenital defect, so I was born with it. Did not know I had this condition. Found out through an EKG because I had to have another surgery.
Linda is a very young woman in her 40s who runs her own business, works really hard, and about a year or so before she visited me, she was getting progressively shorter breath. The important points to understand about Linda's case is that because she's so young, she really didn't want to have a prosthetic valve put in her heart. And that was a wise thought, because a prosthetic valve will actually shorten one's life when it's used in the mitral position.
I chose Delray Medical Center. First of all, it has an enormous reputation. Me being in Florida for 20 years, I know all about many of the hospitals. Delray has always been an outstanding one. My primary reason, though, was the doctor, Dr. Richard Cartledge, who I had a consultation with after having a consultation with 7 other surgeons, because this is something you just don't, take lightly. You want to get opinions. I came right back to him because he's just a fantastic doctor. Not only is he a fantastic doctor on paper, but as a human being, he's just caring. I'm going to get emotional now because he really, it was a big journey for me. So he just understood that, understood what my wants and my needs were, really addressed them with me. And the biggest part of it is he's just spent so much time with me during his consultations, and he told me as many times as you need to come see me, there's not a problem.
A common assessment that you hear from heart surgeons when dealing with mitral valve disease, and that was that Linda needed her heart valve replaced.
Dr. Cartledge was the only man who said, I'm going to repair this valve for you because you will have years added to your life. You will not have to be on any medication, and you're going to have to go back to your normal activities, which was extremely important to me.
When she saw me, the first thing we discussed is the Delray Medical Center experience with mitral valves. Based upon the echo information that we had preoperatively, I was extremely confident that we could repair her valve using complex techniques. Her surgery went beautifully. We repaired her mitral valve. It works perfectly now. She does not have to be on Coumadin. She's on no new medications, and she's gotten back into her normal life within a few weeks.
The nursing staff was incredible. And they, again, why I chose Delray, I know that they have a great nursing staff. The reputation is unbelievable. What surprised me the most is the fact that I'm sitting here today, not even 8 weeks after a surgery, and I can sit here and tell you it was not a big deal. Dr. Cartledge had told me, do not worry about the cosmetic results of the scar. When I woke up from the operation, the first thing I did was look down, and there was nothing there but this clear line, and the scar is going to be not an issue in the future. So don't let that be part of why, God forbid, you wait or don't have it done, because it's not an issue at all.